If your Chow Chow has a persistent cough, it can be very concerning. I know how distressing it is when our furry family members aren't feeling their best, and it can be especially scary when they have something we've never dealt with before. In today's episode, we are going to discuss the top 6 things you need to know about kennel cough for Chow Chows. But before we get started, welcome to our channel, one place for all things dog. We make dog videos that are educational, entertaining, and sometimes just a little bit silly. And if you're a dog lover, we hope you stick around. So hit that subscribe button and ring the bell to stay notified when we release new videos. Kennel cough is a highly contagious respiratory infection that affects dogs. It's also known as canine infectious respiratory disease complex, or CIRDC. The term kennel cough actually refers to a specific sign of this disease, which is a dry, hacking cough, and it can be caused by many different viruses and bacteria. The most common cause of kennel cough is a bacterium called Bordetella bronchicephala. Other bacteria and viruses that can cause kennel cough include canine influenza virus, canine distemper virus, parainfluenza, betus, and sometimes even parasites like lungworms can cause symptoms similar to kennel cough. Kennel cough is very contagious and can spread easily from dog to dog through respiratory droplets released into the air when an infected dog coughs or sneezes. Dogs can also become infected by inhaling these droplets or by coming into contact with contaminated surfaces or objects. The incubation period for kennel cough is typically 3 to 7 days, meaning that it can take up to a week for symptoms to start showing. After a dog has been exposed to the virus or bacteria, most cases of kennel cough are mild and resolve on their own within 2 to 3 weeks. However, some dogs may develop pneumonia, which can be light. Kennel cough is primarily spread through close contact between dogs. This means that it is most commonly seen in places where dogs are kept in close proximity to each other, such as kennels, animal shelters, grooming facilities, dog parks, and doggy daycare. If your Chow Chow goes to any of these places regularly, there's a chance they could pick up kennel cough from another infected dog. While kennel cough is usually more common in puppies and dogs with weakened immune systems, any dog can get it. Once your dog is infected, they will be contagious for up to 3 weeks, even after they start to feel better. This is because the bacteria and viruses that cause kennel cough can still be present in their respiratory system, and they can still spread it to other dogs, even if they don't have symptoms anymore. So now let's talk signs and symptoms of kennel cough. As we mentioned earlier, the most common sign of kennel cough is a dry, hacking cough. The cough often sounds like a goose honk or a seal bark. Other symptoms can include a runny nose, sneezing, lethargy, fever, loss of appetite, and difficulty breathing. In severe cases, dogs may develop pneumonia, which can cause symptoms like a persistent cough, high fever, rapid breathing, and a reluctance to move around. If you notice any of these symptoms in your dog, it's important to take them to the vet right away so they can receive treatment. Now, let's talk about diagnosis. Your vet will start by asking you about your dog's symptoms and history, as well as any recent exposure to other dogs. They will also perform a physical exam and listen to your dog's lungs to check for any abnormalities. In some cases, your vet may take a sample of your dog's respiratory secretions to test for the presence of the bacteria or viruses that cause kennel cough. But in most cases, diagnosis is based on your dog's symptoms and history, because a lot of the time the clinical signs are pretty specific to kennel cough, and it's fairly easy to diagnose. Now let's talk about treatment. Luckily, there are a number of things you can do to help your dog feel better while they're dealing with kennel cough. Most cases of kennel cough are mild and resolve on their own within a couple of weeks. But there are a few things you can do at home to help your dog feel better. First, make sure your dog gets plenty of rest. A tired immune system isn't going to fight off infection very well. Second, offer your dog a healthy diet full of nutrients to help support their immune system. Third, keep your dog hydrated by offering them fresh water. Fourth, consider giving your dog a humidifier to help soothe their cough. Fifth, you can also try giving your dog over-the-counter cough medicine made specifically for dogs. Just be sure to follow the directions on the label. If your dog's symptoms are severe or persist for more than a couple of weeks, be sure to take them back to the vet. They may need to be hospitalized for treatment. And in severe cases, dogs with kennel cough may need oxygen therapy or intravenous fluids. Prevention is always the best medicine. There are a number of things you can do to help prevent your Chow Chow from getting kennel cough. First, make sure your dog is up to date on their vaccinations, including the one for kennel cough Bordetella. This is a vaccine that is recommended by the American Animal Hospital Association, but it's not currently a core vaccine. Core vaccines are those that are considered essential for all dogs, while non-core vaccines are recommended based on a dog's individual risk factors. Currently, the DA2PP, which protects against distemper, hepatitis, parainfluenza, and parvovirus, is a core vaccine for dogs, while the Bordetella vaccine is considered a non-core vaccine. However, because Bordetella is one of the most common causes of kennel cough, and it is so contagious, we strongly recommend that you speak with your vet about vaccinating your dog against it, especially if they go to doggy daycare, boarding facilities, or dog parks. The vaccine is typically given as a nasal spray and needs to be administered every 6 months. Second, avoid areas where other dogs have recently been. If possible, this includes dog parks, beaches, trails, and other public places. If you can't avoid these areas, then try to keep your dog away from other dogs as much as possible. Third, wash your hands thoroughly with soap and water after being around other dogs, especially if they have shown signs of respiratory illness. This is especially important if you have a puppy or a dog with a weakened immune system. While most cases of kennel cough are mild and clear up on their own, there are a few things you can do to help your dog feel better while they're sick. First, make sure your dog is getting plenty of rest. A tired immune system isn't going to fight off infection very well. Second, offer your dog a healthy diet full of nutrients to help support their immune system. Third, keep your dog hydrated by offering them fresh water. Fourth, consider giving your dog a humidifier to help soothe their cough. Fifth, you can also try giving your dog over-the-counter cough medicine made specifically for dogs. Just be sure to follow the directions on the label. If your dog's symptoms are severe or persist for more than a couple of weeks, be sure to take them back to the vet. They may need to be hospitalized for treatment, and in severe cases, dogs with kennel cough may need oxygen therapy or intravenous fluids. We hope you enjoyed learning about the top 6 things you need to know about kennel cough for your Chow Chow. We know how scary it can be when our furry friends aren't feeling their best, but with a little knowledge and care, you can help keep your dog healthy and happy. Did you find this video helpful? Let us know in the comments below. And before you go, make sure you hit that subscribe button and ring the bell to stay notified when we release new videos. Thanks for watching. We'll see you next time.